Hi and welcome back to doc.offcall. For those who are new to the channel, my name's Dr. Maddie and I'm a doctor from the UK. And in today's video we're going to be looking at the highly requested anime show called Monster. And for those who haven't heard about it, it follows the story of a Japanese neurosurgeon who gets caught up in a serial murder case. And after getting accused as a suspect, he tries to clear his name by bringing the true villain to justice. So today I'm going to be reacting to the show and breaking down fact from fiction and telling you how accurate this anime is. But before we start, if I can ask you for a small favour in giving this video a like, it really helps to support the channel. And with that being said, if you're ready, let's begin.
Another perfect operation by the peerless Dr. Tenma.
No, I couldn't have done it without your help. Thank you all very much. It's not midday already, is it?
Well, you know that surgery did go on for almost 6 straight hours.
Yeah, so it's not uncommon for surgery to go on for several hours. I think the longest surgery I was involved in was maybe 7 hours where we had to remove cancer from someone's neck. And remember, all that time you're stood up holding surgical equipment in place. I remember the worst part was the lower back pain and the hand cramps. So it not only involves surgical skill, but also stamina and physical fitness to be a surgeon.
Look at the TV. They're talking about you.
Mr. Rosenbach's diagnosis showed a ruptured aneurysm in his cranial artery. The operation went smoothly, including the successful clipping of the patient's cerebral hemorrhage.
Yeah, so that's one of the big things I like about this anime, how medically accurate the science is in these scenes. They use the correct language and terminologies that I would also use at work. Also, I'd say that Dr. Tenma's lifestyle revolving around his surgical job is also very accurate. I remember having to work nights, weekends, unsociable hours, and just catching up on sleep in between.
Are you Dr. Tenma?
I am.
Give me back my husband! My husband was dying and he was brought to this emergency room first! But you made him wait to be operated on!
Okay, so this is the wife of a Turkishman who was brought to the hospital but unfortunately died because he wasn't operated on quick enough. Now, the process by which we prioritise our patients for surgery is something called triage. Now, in this assessment, we assess what the exact injuries you've got, how unwell you are when you come to hospital, and how you might be able to respond to our initial treatments. And this process is really important when you only have one surgeon in the hospital. You have to ensure that they see the sickest ones first. And this process shouldn't be influenced by factors like your wealth, occupation, your gender, or ethnicity.
I was about to start surgery on a Turkish man injured in a construction accident.
Dr. Tenma, you shouldn't be here right now, Doctor. Get over to OR1 immediately. These are the director's orders, Doctor, so please hurry.
Okay, so here we see that Dr. Tenma had intended to operate on this Turkishman before being redirected by the clinical director to operate on someone else. Now, this in of itself isn't abnormal, as the director tends to be the most experienced or senior surgeon who runs the department. And so when you receive orders from a senior, you'd likely trust and follow their advice, appreciating that they've probably got a broader overview of all of the workload in the department.
I'm not responsible. Well, am I?
After all, people's lives aren't created equal.
Bring him back! Give me back my husband! Bring him back!
So this is the director's daughter, and she just so happens to be Dr. Tenma's fiancée. And the reason that this statement shocks him so much is that as doctors we have an ethical code. And one of the main pillars of this code is the idea of justice, in that all patients should have fair and equal access to all healthcare resources. So for the director's daughter to be exposing her values this way causes Dr. Tenma to begin to question what are the director's values when allocating work.
A suspicious group of civilians forced their way into the hospital. They claimed we pushed back the case of a Turkish man who'd arrived at the ER first. That's not how it happened. That Turkish man was operated on first. Right, Tenma?
So here Tenma faces the director himself, who flat out lies about the death of the Turkishman. Now, this is quite a striking experience for Tenma, as he's beginning to see how unethical the director can be. Remember, as doctors, we're supposed to be some of the most trusting people in society. Witnessing your senior not upholding these values would cause you to question whether they were ethically compromised in the decisions they were making.
Where's the patient?
They just brought him in.
How's he holding up?
Blood pressure 72/50. His pulse is at 137.
The bullet entered through his forehead.
So back to the hospital, and a young boy called Johan has been brought to the ER department after being shot in the head. Now, this fellow doctor states that Johan's blood pressure is really low and that his heart rate is really high, which tells us that he's critically unwell and could die from his injuries if he's not operated on soon. Fortunately, however, Dr. Tenma's a neurosurgeon, so he's the best man for the job.
Who's this?
She's the twin sister of the little boy we just brought in.
Any injuries?
No, but she seems to have sustained a serious psychological shock.
Yes, what is it?
Yeah, so psychological shock is a real thing, and it's otherwise known as an acute stress reaction. Typically, it manifests with an intense emotional or psychological response to witnessing something that's so traumatic or distressing. Like in this scene, it occurs immediately after the traumatic incident, overwhelming the person's ability to cope or even process the event. And the types of symptoms and signs you might see are an intense feeling of fear or horror, or re-experiencing the traumatic event through flashbacks.
This one is definitely going to be difficult. The bullet is touching the left side of the middle cerebral artery, here.
If you jostle the bullet even the slightest bit, then the artery could rupture and cause a massive hemorrhage.
So it looks like here that Dr. Tenma's looking at some x-rays to help determine where the bullet is in Johan's brain. Now, an experienced neurosurgeon would be able to look at these images and determine how complex the surgery might be. In contrast, a less experienced surgeon might want to get CT scans or MRIs before they delve into the operation. However, the only problem with those is it takes far longer to actually carry these out as investigations, which might delay the surgery.
Oh, there you are, Doctor.
Yes?
You shouldn't be here. You're needed in operating room 1 immediately. It's critically urgent. Mayor Rodecker has suffered a cerebral blood clot.
So once again, Dr. Tenma is being pulled out of theatre, and this is quite abnormal because he's already dealing with an emergency case and he's also scrubbed in. It's quite rare at this stage of an operation to be pulled out and reallocated elsewhere.
It's an order from the director.
Tenma, I'm expecting you to do everything in your power to save the mayor.
In the next review of medical facilities, the mayor has promised our hospital a very generous increase in funds.
So now is a key moment for Dr. Tenma, as the director has shown his clear agenda for treating the mayor over Johan. And you could argue that they're both in life-threatening condition, and so it's not easy to prioritise one over the other. Really, you've got to ask yourself, is the director really wrong for wanting to prioritise the mayor, who may well go on to help the hospital and also help further patients? What do you guys think about this dilemma?
I have a surgery to perform in the other room.
Dr. Tenma!
Dr. Tenma!
Hang in there, kid. I'll save you. No matter what.
So Dr. Tenma chooses to operate on Johan rather than on the mayor. Was he right? I really don't know. I think you could argue that as Dr. Tenma's already scrubbed up and his patient's already prepped on the theatre bed, that operating on him might be the most efficient use of his time. I think if I was in this position, I'd probably do the same thing, but I'd ask if there were any other surgeons who could start operating on the mayor, and then I'd come and assist once I was done. Also, you could make the ethical argument that Dr. Tenma was right in choosing to operate on the child before the adult, because of the amount of potential years saved treating a child compared to the mayor.
I will begin extracting the bullet. Bullet is extracted.
So the majority of this is pretty accurate, but to do an extraction of a bullet like this, you'd probably want to do it with a bit of additional imaging, whether that's x-rays or fluoroscopy, just so that you can make sure you get all of the bullet out as well as all the other fragments.
It looks like the procedure went smoothly on your side. The mayor wasn't so lucky.
That's very unfortunate news.
The problem is, you selfishly left us a man short. We had to scramble to cover for you at the last minute and somebody died.
So it looks like the mayor has died and Dr. Tenma's being blamed for not having operated on him, which is pretty unprofessional coming from your work colleagues. Really, the mayor was in a life-threatening condition and the chance of death, both with or without the surgery, was still very high. So yeah, Dr. Tenma could have gone and operated on the mayor, but that doesn't guarantee that he would have saved his life. I think what people need to appreciate is that despite the best efforts of doctors and modern medicine, there's some people who just can't be saved.
If you wish to remain at this hospital, you may do so, but you'd better give up any dreams of furthering your status. It's not possible for irresponsible people such as yourself. I recognize your skill as a surgeon, but that is it.
Okay, so the director finally shows his hand and basically tells Dr. Tenma that he's going to ruin his future career for not having followed his orders. So this sort of thing shouldn't really happen. If you have true concerns about someone's ability to practice or their level of professionalism, it should be raised to an independent body. In the UK, we have the GMC, or the General Medical Practice, who look at the case independently and then decide who needs disciplinary action.
Wait, is that the engagement ring I gave you?
Spare me, Kenzo. You're such a fool.
Oh gosh, that is cold. So she's just choosing to drop out the engagement. Really, this tells you the character of the director, who uses his daughter to get talented surgeons on board like this.
He tells me there's a flaw in my character. Well, what about him? He says he's a doctor, but he's just a greedy bastard. Bastard! Bastard! He'd be better off dead!
So I can completely understand where Dr. Tenma's coming from, and I'm sure you guys can empathise with this situation too. However, I probably wouldn't go and sit by my patient's bedside and exclaim things like this. But it looks like Johan's in a high dependency unit, with him having some cardiac monitoring as well as being on a ventilator, which is quite normal after a high risk surgery that he's had.
I have to thank you because you helped me open up my eyes as a doctor. So survive and live a good life. After all, I did throw away everything in order to save you.
So this is where the penny dropped for me with this anime. It definitely started to take a different turn after the first time we saw the evil in Johan's eyes. But just a little inaccuracy in this scene is that if Johan was truly conscious, he probably wouldn't be able to tolerate that endotracheal tube that he's got taped to his mouth. From my experience, this is the first thing that people try pulling out after coming round from an anaesthetic.
Your name is Anna Liebert, isn't that right? Isn't there anything we can do, Doctor?
She's fine physically, and I think her trauma-induced amnesia is natural, given the circumstances.
Yes, so trauma-induced amnesia is a real thing. It's otherwise known as psychogenic amnesia or dissociative amnesia, and typically it's memory loss that occurs after a traumatic event. And interestingly, the exact mechanism of why it develops isn't fully understood, but it's believed to be a defense mechanism that the brain can deploy to help to protect the individual from overwhelming distress. Fortunately, the memory loss tends to be temporary, with it spontaneously resolving with time.
So their story is a pitiful one. That works for us. Just take Dr. Tenma off the case. Here, why don't you have one?
Thank you.
So here we're seeing that other doctors from the hospital are complaining about the lack of appreciation they're getting from the public, whereas Johan, on the other hand, is getting loads of letters and gifts. To be honest, it doesn't sound like those doctors are in medicine for the right reasons. And really, it's kind of narcissistic to then go and steal candy from Johan's gifts, especially when he's still unconscious in the room.
Excuse me, Dr. Boyer, are you still in a meeting at this time of night?
Okay, so later on that night, all three of those doctors were found dead, which is very suspicious, thinking about how unethical they were portrayed in the last scene. From the way that they were found without any trauma around the body, you've got to be worrying as to whether they were poisoned or drugged.
I am Inspector Lunge. I'm here from the BKA. We have discovered traces of nitrate inside all three of their bodies.
It's a muscle relaxant.
Exactly. I see you're not a doctor for nothing. It was candy.
Huh? Candy?
So yes, these were poisoned candies, as I'd suspected, but unlike Dr. Tenma, I've not heard of nitrates being used as a form of a muscle relaxant. Normally, in my daily practice, we use nitrates for the treatment of things like angina or ischemic heart disease. Also, it begs the question as to whether those candies were intended for the doctors to eat, or were they gifted to Johan to try to kill him. The plot's definitely thickening.
Mind if I ask you something? Why does your hand move like that?
Oh, this, I was just typing. I'm inputting all the information onto the hard drive in my head.
So you're probably all wondering the same thing. What's up with those hand gestures and can it help with your memory? So yes, all this is a memory technique, much like how people might use acronyms, songs or visual imagery to try to remember something. This is just Detective Lunge's way of doing it himself. It's thought that these memory techniques help to create mental hooks or associations so that it makes it easier for you to remember things. But I do wonder whether Detective Lunge is on the spectrum, as a lot of his characteristics and the way he communicates tends to weird out a lot of his colleagues.
Let me say this again. I'm performance-oriented, and that's the reason I'm making you Chief of Surgery.
So, Chief of Surgery is definitely a big promotion. Really, he'll now be taking over all of the surgical services in the hospital. Normally, this is an achievement that takes many decades for any normal doctor to achieve, and with Dr. Tenma being a Japanese foreigner, this is even greater an achievement.
Is this the patient?
Yes.
It's important that we get his testimony since it may help us solve a string of serial murders.
There's a top-notch neurosurgeon at Eisler Memorial Hospital. He might be able to do something.
That would be Dr. Tenma.
So several years have now passed since the last scene, and several more suspicious murders have occurred around Germany, with the leading detective being Detective Lunge. And one of his main suspects is this patient, who's been brought in after a road traffic accident. And as a result, he sustained some head injuries, requiring urgent neurosurgical treatment. And of course, the only surgeon who can help him is Dr. Tenma, bringing Detective Lunge and him back together.
How is the patient responding?
Well, he is still conscious, but his right pupil does remain dilated. He's also got paralysis on the left side.
But he has already started rehab, hasn't he? The paralysis should go away.
So, Dr. Tenma successfully operates on this suspect, and he's right in stating that the paralysis will improve with time. Really, straight after surgery, there's loads of swelling and irritation around the nerves and blood vessels in the brain, and so you need to give this some time to calm down before you could estimate the amount of function the patient might be able to restore. Also, there is the concept of neuroplasticity, whereby if there's a damaged part of the brain, other areas can sometimes compensate for the lost function by adapting their roles and picking up the slack. And this is the reason why it's so important to start rehabilitation as soon as possible after surgery to get the brain learning again.
So tell me, who is the person who hired you to do this?
That's it! This interrogation is over right now!
And just to make sure he isn't poisoned or that he doesn't disappear, I will assign a guard to watch him closely.
Again, it looks like Mr. Junkers also has trauma-induced shock, a bit like Anna Liebert did in the earlier scenes. But it looks like even the mention of his employer is causing Mr. Junkers to experience an acute stress response. Now, appreciating that amnesia can be a component here, it's probably not sensible or reliable for Detective Lunge to be questioning him about details of this murder case. In fact, the police know not to do this, as there's been people who've given false eyewitness testimonies that have resulted in the imprisonment of innocent people.
Hey, what's the matter? Are you all right? He's dead. Candy.
And so our killer has struck again, and once again he's done it with these candies. And it doesn't look good for Dr. Tenma to have been involved in both cases with the same mechanism of killing. But how do muscle relaxants kill you? Well, what they actually do is they decrease your breathing rate as well as other vital functions to the point where you actually die from asphyxiation.
Stay away, Doctor!
Who are you?
Oh God, just run! Run away! Please!
You know, I have to say the sound design and foreshadowing for this murder is fantastic. Although some people argue that this is a slow burner of an anime, they definitely know how to build suspense, and boy does it pay off.
It's me. 9 years ago. You saved my life.
9 years ago?
Have you forgotten already, Doctor? About the twins?
Johan.
So it finally drops, and yes, it's Johan, the child that Dr. Tenma saved and prioritised operating on. Imagine how conflicted you'd feel in Dr. Tenma's position. Probably the single most important decision of his career was choosing to operate on Johan over the mayor. And so to see Johan here would probably be the last one that Dr. Tenma would expect.
Don't add to your crimes, Johan!
Yes, there was a time when I went by that name. But you know something, Doctor? Johan isn't my real name. You must never know about my past, not about those 4 couples, nor the Lieberts.
And with that one line, the plot of this story thickens, and it raises so many questions. Who is Johan? Does he have multiple personalities? What caused him to change from being that young boy to this now murderer? And is he a psychopath?
But you're different, Doctor. You cared for me and you restored me to life. So I feel as though you're like a father to me. The truth is, if it weren't for you, I wouldn't be standing here right now.
You know, just listening to the way Johan speaks makes you more scared of him as a character. Everything that he says seems to be weirdly logical, but also very emotionless, which can be characteristics of a psychopath. But you know, Johan seems to have many features that are consistent with a psychopath. He seems to lack any empathy towards his victims, and strangely he almost comes across as charismatic, but also quite highly manipulative of Dr. Tenma in their discussion. Also, he doesn't seem to feel guilty for any of the murders that he's been responsible for. In fact, he almost comes across as self-righteous. And the key to the diagnosis here isn't that he has all of these features, it's that he has all of these features and he chooses to engage in criminal activity and overtly aggressive behaviour.
Stop it! You can't just go around killing!
Why not?
Why not? Because a human life is precious, don't you see that? Rescuing you opened my eyes. I was able to go back to being the doctor I should have always been.
So I think the reason this story is so compelling is because you've got Johan and Dr. Tenma on the complete opposite sides of the moral compass. Their relationship kind of reminds me of some of those that we see in comic book stories, such as between the Batman and the Joker. Let me know what you guys think down below.
You are where you are today because the director and the others died, right? I'm so glad I was able to help. That's what you told me. That you hated them so much. You wished they were dead.
God, this moment shakes Dr. Tenma to the core, and I can imagine would really knock him off that perch of being the moral person. He can't deny the fact that he did go to Johan's bedside and in that moment of anger exclaim that his colleagues would be better off dead. Now, is he to blame that Johan wanted to repay that debt for saving his life and therefore killed his colleagues? Or was young Johan to blame? Was he always going to kill those doctors? What do you guys think? Let me know down below.
I don't want to die! Doctor!
I was supposed to die that night. You're the one who resurrected me, Doctor.
You know, once again, this scene is so well scripted to help depict how much of a psychopath Johan really is. Just him using the term resurrected rather than saving my life depicts him in some form of grandiose state. The only time I've ever heard of something being resurrected was whether it was Jesus Christ from the Bible or whether it's a monster like the Mummy. Johan's clearly using this language to try to manipulate Dr. Tenma into feeling a shared form of accountability for the murder he's just witnessed. And this is why I think Johan's one of the greatest anime villains of all time. Okay, so as I suspected, this was a really accurate anime. I have to give credit to the writers, they've really done their research. Now, if there's any other scenes from this series that you would like me to break down, please leave those down in the comments below and I will try to put out a second video. Otherwise, as always, thanks for watching guys, and I'll see you in the next one. Thanks.